Hello, it's Thursday again. That comes around quickly, doesn't it?
It
is John Radcliffe Hospital. This is the infant feeding team. I'm Naomi. This is Alex. And this is our infant feeding session. So we've got an hour of questions and answers as usual, and always have brilliant questions. And hopefully we can answer them all for you again this week. We've done many of these now, and we're hoping to carry on and keep going. So please do come in and join us and tell your friends about us and family, so that they don't have to be in Oxfordshire. Anyone can join in and bring in lots of questions for us, as long as they're about infant feeding.
Yep.
So we don't really want to talk much about scans and your midwife visits and giving birth and things like that, because it's not our area. We are midwives, but we don't work in those areas very much, so you're best talking to people that are involved in that care. So anything that you feel has been niggling you, or somebody said something to you, or you've had an experience you want to discuss, post your questions down there, and hopefully we can answer them. And we do get some great things. We do sometimes get themes, so we sometimes have sessions which is all about colostrum harvesting, or sometimes about pumping or positioning and attachment or later feeding problems. So if you're giving any milk to your babies, whether it's by the breast or in a bottle, or you're weaning, or you're talking about sleeping with your babies, in sleeping and breastfeeding, how to manage everything, that's what this session's about. And it's about sharing your information to encourage other mums as well, because we get lovely stories about how well you're doing, as well as the people that haven't managed to do as well as they wanted to do. We get lots of positives, so we just love hearing about what you've got to say about everything. And I'm hoping that you're going to be listening to us today and not Christmas shopping, because it's quite close now, isn't it? And we're allowed to say things like Happy Christmas to people, aren't we? So hopefully you'll have time to sit down and have a drink or something.
They can have next week off for Christmas shopping, because we can't do next week.
No, we can't do next week.
So next week's a weekend, the Thursday.
Thursday off
shopping.
Next Thursday. That's your wrapping and Christmas shopping day, and going to the post office. Good luck. Anyway, we've had a busy week as usual, haven't you? We've been busy doing some exciting things that we may announce in the next few weeks, so watch out for that. And we've also been seeing mums in clinic this morning. That's been a busy, brisk clinic again this morning, and we've seen lots of lovely babies, and we've been on the wards and seen mum on the wards, and we've had lots of phone calls already. So we manage it in lots of different ways, and we sort of go around all over the place when we're working here. We don't just stay on maternity. So if you're having surgery or something like that, we get involved sometimes with your if you're having a general anaesthetic or something, you might want to contact us about the drugs that you're having, or the type of surgery you have, how you'll manage your feeding. And that might be when your baby's 7 or 8 months old, or more than that. Your baby might be in hospital, and it might be a little bit older, and you want to talk about treatments that your baby might be having, and managing breast milk if your baby's not able to take milk by mouth or won't tolerate it. We talk about that. We see mums on neuro wards and medical wards.
Wherever they are, wherever mums end up.
A&E. We get called to manage if we can. We can't always see everybody because we can't spread ourselves too thinly.
But we can give telephone help.
Telephone advice and things. So we are busy. We're not just based on a ward. In fact, we're not based on a ward. We're based in the maternity hospital. So we go all over the maternity places, but also we go over to the John Radcliffe main hospital as well, and the children's hospital. So we are, we do lots of footsteps, don't we, in a day? Quite often.
I'm just going to answer the first point that's come up here.
Lovely.
Another Naomi. So, she says, can I ask a question about my baby's feeding? Please do. Go ahead, Naomi. Pop it up there. So we'll answer it as best we can. So see how you get on.
I just thought one question.
We've got another one after us, but I was just going to say, you do by all means put your question up. That's absolutely what this is for. We'll do our best to answer it. And if we can't, we will either speak to you afterwards or signpost you somewhere else. So.
And I hope you're all buckling down the hatches with the the COVID situation again. It's hotting up again, isn't it? So we're all on alert here with just being aware of what's happening. I think most of the staff are vaccinated, and certainly a lot of the boosted, and a lot of the mums have had their vaccination most mums, I would say, have had their vaccination that we speak to. And we know that the ones that haven't are in hospital and are much more poorly, and we have seen some mums that haven't been vaccinated in the ITU, so they've been very poorly. So it is happening, but lots of our mums are having the vaccine, and hopefully you listening are also doing the same, and trusting that it's okay and it's safe for your babies, and to know that if you have it when you're pregnant, it goes through to your baby in the pregnancy, and your baby gets vaccinated from you. And also when you're breastfeeding and you have it, then it's present in breast milk, and it is present for up to 10 months. We know that the immunisation, that's the latest research that they've looked at, or one of the latest pieces of research, that they found that post-vaccination that there's still immunity at 10 months. So they haven't got much more than that, because it was a year yesterday since we had the first vaccine in Oxford. So you know, in England. So actually we can't do long term, but we know that it's a safe vaccine, and we know that it's very similar to other vaccines that have been made. So it's a derivative of a vaccine that might help protect against colds and flus and things. So it is not an unknown, the one that we're giving, or the ones that we're giving in the UK. So hopefully you're considering it, or you've had it, and protecting your family and people around you. And staff have it to protect you as well. So we're wearing the usual staff masks, gloves and pinnies, and if you're COVID positive, then we step it up to the next level with different sort of visors and things on as well. So it's all the same here. We haven't changed our practice in any way, and we're looking after everybody as safely as we can. So hopefully you feel safe coming in to see us, and our services are the same. We're still running clinics, nothing's changed in that sense either. So keep an eye on the John Radcliffe website to see what's going on. That's the most up-to-date, and for the most up-to-date information on pregnancy and breastfeeding is the Royal College of Obstetrics and Gynecology, the RCOG. You can look at their page as well, and you'll get lots of up-to-date information, the most up-to-date correct information to follow, and this about safety and everything else if you've got any concerns.
Yeah, Brenda Kelly's done some lovely
Facebook
lives and some presentations.
Questions.
Got a few questions coming through. Should we go on to them?
Yeah.
So hopefully Naomi's is going to come through shortly. I haven't seen it come through yet. But Sally has said, "Hi ladies, I'm 37 plus 3. I've just started practicing to try and express colostrum. I've had some leakage, but it's clear and sticky. Is this normal to begin with? Should I wait until it's more yellow before I store it?" Nope, everybody's is different. So yours will be just perfect for your baby. So it doesn't matter if it's clear. And it's really interesting because mums have about 9 nipple pores on the nipple. And actually what they'll find is when they start hand expressing, they might find that from one it's one colour, from another it's another colour. And it's amazing how from the same breast, same nipple, you get different coloured colostrum. It's all fantastic. Whatever colour it is, it's fantastic. So don't worry about yours being lighter. Maybe you don't eat quite as many carrots as somebody else.
What you eat. So sometimes, you know, beetroot and things like that, it changes. And
yeah, beta carotene is one of the things that will impact on it. So if you eat loads and loads of carrots, it's going to be much more yellow. But give it a try, have a go. But no, it doesn't matter that it's light in colour. It doesn't matter at all. It will be sticky. It's always quite sticky. Yeah, I always say it's a bit like golden syrup, but don't worry about the colour. Your colostrum is totally perfect for your baby, completely and utterly bespoke with every antibody you've ever produced. Remember, it's like a baby's first vaccine, and that's what these early days are about. Colostrum is about protection. It's about a laxative to get rid of the meconium in the gut, to make sure the babies are protected against jaundice. There's lots going on here, not necessarily just food. So Sally, don't worry about your colour of your colostrum. It's absolutely normal.
And actually, you know, when your milk becomes transitional, it often becomes quite orangey yellow, and then it becomes almost white blue colour when it becomes mature milk. So colostrum is for the first 2 or 3 days, and then it becomes transitional between about day 3 and day 5, and then by day 5 onwards it should be mature milk, and that stays mature milk until you stop breastfeeding.
Yeah.
And you know, sometimes it's greeny, sometimes it's bluey, sometimes it's yellow, sometimes it's orange.
It just reflects what you've been eating.
It does, and what's unique to you. And sometimes it's almost see-through, and you think, oh, that looks a bit watery. It doesn't look like it's got any goodness in it, but actually it has. It's absolutely fantastic. I've
heard it described as dirty dishwater by somebody. Someone said to me that their milk, they thought their milk were like dirty dishwater. it's still perfect.
Sometimes it's pinky, your colostrum, when you first start expressing, and as long as it's on both sides, we don't worry about that. And sometimes it's green. We've seen every colour under the rainbow, I think. And it's normal. It's just normal. So don't panic about any of those things. But it does, and it has got lots of good factors in it, whatever colour it is. And sometimes in the evening, it's slightly more white than it is bluey, as the amount of lactose changes, the volume of water in the breast milk changes as your breasts aren't quite so full. You get more fatty milk out, 18% more fat comes out in the evening, so your milk becomes much more sort of white, dense looking than it is first thing in the morning when it might be clear and blue.
Yeah, absolutely.
So don't panic.
It's perfect for your baby.
Yeah.
So do by all means, if you want to start, carry on with the expressing. I'll just reiterate what we say every week whenever anyone asks: is storage of your colostrum when you come in is difficult. Please don't bring too much in. Bring a syringe or two maximum, depending on how much you've got. Bring it in a cool box with ice blocks, because once it's defrosted, it has to be used within 12 hours. So if anything, bring in the most recently done and leave the rest at home. And then it can be brought in if you need it. So if you've got some that you've done, the day before you go into labour, then actually it's fine for 5 days. So that's the best one to bring in. You can just keep it in a cool box, and we don't have to worry about it defrosting. The problem with it when it's frozen, it's removed some of the protective properties that are in colostrum, which means that we need to use it fairly quickly after being defrosted. So if you can bring fresh in and leave the frozen at home and only bring it in if you need it. So we have a real issue with it going missing in the hospital. Hang on to it, keep it with you. Yeah, don't hand it over. Yeah,
because if it's not clearly labelled or it's put somewhere last minute, people don't know that you're tied to it. They don't, if you're not on the ward anymore, they don't know who you are.
And you work your way through the building. You'll come in and you'll get triaged in MAU, the maternity assessment unit. Then if you're in labour, you'll go on to delivery suite, and from delivery suite, depending on what your birth is like, you might go to observation area if you need a bit more care, or you might go up to level 5, and we've got to rely on it following you around the building. And that's what sometimes doesn't happen, which is why we appeal to you not to bring in lots, and bring it in a self-contained unit that you can keep with you all times.
And if you have an induction, you're on level 6.
Yeah, exactly.
And then you go downstairs and someone doesn't follow you with the milk, and then people don't know that you were on the ward, and they don't recognise the name, and it just disappears because they think you've gone home and left it, or so it's human error when it happens. So protect it by keeping it in your own freezer.
Yeah. And
hand express when you're in labour.
Yep, because that's fresh and you can keep it for 5 days.
Yeah, and it's it's brilliant, and it can be 48 hours on your locker. So without even finding a fridge. So, or 24 hours certainly, and then it's okay to use when you've had your baby. But as we always say, make sure if you do give it that you hand express as well, and you breastfeed and hand express if your baby's being born. Don't give all the stuff you've got. You can give that as well, but make sure you do the stimulations, because we know that if you don't do those early stimulations, your milk supply goes down. So don't use it instead of, use it alongside, and do lots and lots and lots of stimulation with breastfeeding and hand expressing in the first 2 or 3 days, just to really kickstart your supply. And I saw another lady in clinic this morning, and she had loads of milk on her right breast, on her left breast, because she was right-handed, and I said, was that the one that you fed on when you first had your baby? And she said, I think it was. And she got much more milk on that side than she had on the other side, which is the side she didn't use straight away. So the other thing we say is, if you breastfeed on one breast in the labour ward, hand express on the other side to really step up that production, and then you'll have lots in both breasts when you need it. Can't do too much.
Hope that helps, Sally. Hope that's a good answer.
That was a really long answer.
Yeah, sorry. Quick question, long answer. Right, Fru Frere has said, hello, thanks to your help, Noam and I are still going strong at breastfeeding 10 plus months in. To everyone out there struggling, it can be so tough at the beginning, but you can do it, and it's so worth it. I'm due back to part-time work in January. Noam will attend nursery 3 days a week. At the moment, he has 4 daytime feeds plus night feeds on demand. Question, will I need to pump 2 times a day when working? I'm not keen on pumping, but don't want to A, lose my supply, or B, get blocked ducts or mastitis. Could I get away with pumping once a day? I think go with how you feel. See how you're feeling. You know,
it's another month older in January, so another change.
I think be prepared that you might have to pump twice, but you might get away with once. The risk is obviously if your breasts get very full that you go on to develop blocked up mastitis, which you don't want really. So it's being very aware. We talk a lot about keeping your breasts comfortable, so making sure that you use that pump. So if you're sitting there thinking, oh no, I'm really feeling quite full now, go and pump and get it off. The fact that you're going to be feeding through the night, baby, the likelihood is Noam will actually demand quite a lot at night because he'll be missing you in the day, and he'll want to touch base and make sure you're there and going to meet his needs. So you know, he'll probably cope just fine. But I think it's the thought of it's ensuring that your breasts are comfortable, that you don't allow them to get too full.
And I think the thing is that, you know, when you go back in January, he's going to be 11 months, and then, you know, 2 months later he's going to be 13 months and his needs will change again, and then he's going to be 16 months and his needs will change again. So, you know, take your pump with you and do it as you feel you need to. And obviously your employer, you know, you have got some rights to express and have privacy, and I think the rules change before 6 months and after 6 months with the facilities that they've got to provide for you. So if you go to work when your baby's under 6 months old, I think by law they have to provide you with a place to pump and a fridge and everything else. But I think after 6 months the law is slightly different, and you need to check that. But you know, hopefully you've got a supportive manager that will allow you to have space and not expect you to go to the bathroom to pump, because that's not acceptable. And you know, play it by ear. And it might be that if you're working part-time, that you can get away with only doing it once a day because you're going to breastfeed more the next day. But if you're working 5 days in a row, you probably find that you need to.
I think you said you're only working 3 days.
3 days, yeah. So you might find that you know, it works out okay. But
I mean, the norm would be you feed him before you leave for work, you feed him when you get back, and then you're just going to have to play it by ear during the day to see how you get on.
And I think if you do 3 days in a row, if you the first day that you go to work, you'll have probably been breastfeeding more at home, so you'll have more milk. And then the third day that you're working, it might be that you've reduced the amount of feeds in the day, your supply's dropped a little bit, and then when you have the weekend off or whatever, 4 days off, your baby feeds more again and your supply goes up. So you might find that you have to pump at different times of day depending on what you've been doing the day before and the day before that. It's about 48 hours in milk production, so you know, if you stop pumping in that time, it will suppress your milk a little bit. But you know, with 3 days a week he will breastfeed more and increase your supply again for his needs. So I think it swings and roundabouts. And you've just got to find out yourself.
And good luck and well done, and thank you for your comments. You know, that's hopefully going to encourage other mums. You know, it is, as you say, it's not easy, but it's worth it. You know, breastfeeding is it is natural. It doesn't come naturally. We all have to learn how to do it, and you know, it just takes a little bit. It does take some effort, and more for some than others. You know, so. And
I think you've got to remember that there aren't any rules in breastfeeding. No. Well, there are a few things like pumping 8 times a day and feeding your baby enough and peas and poos and all of that. But actually, the way you deliver it and the type of times that you give and everything else is down to you as parents. You know, and your baby doesn't know any different. Just because your friend does it doesn't mean that that's the normal. It's what works for you as a family and the diet.
Every family is different.
Absolutely, and that's the most important thing that you hear. So if, you know, whatever you do is the right thing to do.
Okay, I hope that helps you. Hannah has said, I think this is in relation to what you were saying about the vaccine. She says, I've had 3 vaccines and extremely grateful I've had them, as have COVID as we speak, and it's kept under control, thank goodness. Well, I hope you get better soon then, Hannah.
Yeah, that's
you
really
poor
tough.
Love. But, you know, and it has been hitting the press that the mothers who, you know, women in pregnancy who are getting COVID can be quite unwell. And you know, if they haven't had the vaccine, they haven't got that additional protection. I
think it's because your baby is pushing up on your diaphragm and on your lungs. The lung capacity is down, and certainly in the last trimester we find women are very poorly because their lung capacity is much less than somebody who's not pregnant, and that means that your capacity to breathe is much less. It's quite hard breathing when you're pregnant and have a big baby underneath your ribcage at the best of times, but you know, when you're poorly and gasping for breath from a respiratory illness, then it is much worse. So that's why it's so difficult.
Yeah, and there's an immune issue involved as well, isn't there?
Yeah.
You know, in order to maintain a pregnancy, our immune systems are dampened down when you're pregnant. So if you think about that, then your immune system isn't so effective during pregnancy because the body's wanting to hold on to the baby. So actually, you have less reserves to fight off a pregnancy, to fight off a bacteria or a virus. So from that point of view, your immune system is a bit compromised, which is why pregnant women are falling prey to it. So which is why we've been saying what we have been saying about, please consider the vaccine. So Hannah, I hope you feel much better soon.
Good luck to you.
Right, Naomi's question's appeared. Hello, Naomi. She's my 6-week-old, 4 weeks prem. Wow, is breastfed but often chokes mid-feed. We saw you whilst in hospital and his latch was checked and you deemed to be okay. And we then had his tongue tie cut, which helped further. But almost every feed he chokes. It's not always immediately on letdown either. Any suggestions?
Well, it might be that it's on repeated letdowns, so you don't just get one letdown when you breastfeed. So as you're breastfeeding, you get less, more letdowns as the feed goes on, and so it might be that it suddenly get a little bit of a spurt of milk when they're not expecting it. But I would look at your latch again. How old's your baby? 6?
Oh, I'm going to scoot back up. I was just checking. 6 weeks, but born 4 weeks prem.
Yeah.
So 2 weeks corrected.
But 6 weeks, 6 to 8 weeks, the shape of the mouth changes. Between 6 and 8 weeks, the shape of the mouth changes slightly. So even if he was a bit preemie, he's still that sort of length, and the development will be that the cavity of the mouth changes shape slightly. And if he's just started doing it, might be that the space between the top of the palate and the base of the tongue has changed slightly. And so you might need to look at your the depth of the latch and just make sure that he's on really deeply so that the milk goes down his throat rather than pooling in his mouth. So he might slip a little bit as the feed goes on, and then you get another letdown, and that's when he chokes. So I think be vigilant. It might be worth going somewhere like OBS where you can drop in and get them to watch your...
It's not drop in, I have to book, don't I?
I mean, as in you can go and see them face to face. You need to book an appointment. Absolutely, all of them are appointments. But you might be able to get someone to check the latch just to make sure that you haven't gone slightly backwards with habits, and he could perhaps go on a little bit deeper, or just look at the latch again and just see if you can get him to go on a bit further. You might need to do sort of supported latch where you're giving him a bit of counter pressure to get him on. We were talking about that actually before we started, talking about babies helping themselves and lots of bobbing and talking about, we've got a doll with us today.
Oh, did we forget the doll?
We've got no dolls and no breasts. How terrible.
This happened to me the other day. I had to use one of the teddies.
So the position that we're looking at, so
she's going to use a teddy.
This is a very, very premature baby. So when you do the laid back position, which is what we're talking about, it's the first time I've done this, forgotten a baby, you want to be supporting your baby. But what does happen is that these babies bob, and they bob and they bob. And if it's early days where your baby's only a few days old or a week old, it's quite hard as parents for you to manage that because you think the head's going to fall off.
Which it won't. It won't.
You think about what you've been through in labour. So it's about managing that and being confident. And it might be that if it doesn't work for you, to try a different position until your baby's a little bit older, or you might want to try what we call the face planting in the early days, so the first 2 or 3 weeks, where they're literally face down and they bob, but they fall onto the breast without doing too much of that bobbing, because it's this bob that mums get really anxious and the babies can't attach. And so it's about taking your baby to the breast and allowing them to get a really big mouthful. You might need to support them on their shoulders a little bit if you start doing this position. Sometimes leaning forwards a little bit to support them and then leaning back when you've got them on also helps. And sometimes rolling up a muslin and putting it under your breast sometimes helps, so it lifts up. So you roll up a piece of cloth and then you put it underneath your breast there, and it lifts your breast up, and that sometimes makes it easier because it tips your nipple up a little bit, and that sometimes helps babies to get on as well. But it is hard when they don't attach straight away and you're struggling to get a big mouthful.
I've just scooted down to see some of the other questions. Georgina, yes please put your question through, that would be fab. She's asked if she can put a question through, and there's a few thereafter. So that was for Naomi. So
I hope that's answered you, but it might just be that you need to revisit that latch and change the way your baby's being held when you're feeding. You know, it might be that you just need to bring them around a little bit more because they've got bigger, and you know, you need to just make room for them to get on in the right place. So get somebody to check your latch. Your half visitor might be able to as well. And if you see if your baby's being followed up by the community paediatric nurses, it may be that they can help you if they come to the house. Not every baby gets visited by them, but
the outreach team.
The outreach team sometimes comes in and sees. So if you're still under them or you've been under them, they may come and check you at home and make sure you can sort of time your visit with a feed, so your baby's hungry when they come, and that might help you.
And I think the thing to say about positioning and attachment is that I'm sure you were doing a fab job. There's often room for improvement, and as the weeks go on, we do fall into sort of not quite such great P&A, and it might be worth just getting someone to look, as Naomi said. So, Caitlin has said, can I ask how it would be best to implement a pumping pattern? I'm due back at work, baby will be 9 months, but I'm still breastfeeding and was unsure where to start. Ooh.
What sort of pump have you got?
Yeah.
What sort of, are you thinking that you're exclusively pumping, or is it just pumping in the daytime when you're at work, or is it that you're going to be going to pumping and not breastfeeding? The regime is always, if you're pumping and not feeding, it's 8 times a day, so 8 times in 24
So if you're,
hours.
if you're feeding all the time your baby's at home, then you might be pumping while you're out, and that'll give your feeds for the next day. If you need a stock beforehand, most mums find they've got more milk in the morning than they need, and that's often a time when you could maybe feed your baby, pump and stockpile that, pop it in the freezer, so you've got some milk ahead of the time of going back to work.
Some people use a hacker, don't they, and they just collect drip breast milk, and that they collect milk over the daytime. But
there is a drawback to the hacker, is it's drip milk, and drip milk is not the high fat milk, so hacker. Yeah, I have a bit of a gripe with hacker calling it a pump, because it's not a pump. It encourages leaking, and when you leak, the milk that you leak is that first part of the feed, the watery part of the feed. It's still amazing. It's full of all the sugar the baby needs. It's full of water soluble vitamins. It's absolutely fantastic, but it's not got all the fat in it, that fat that makes the baby think, I'm full now. This is like giving them a salad each meal time. If you were only going to use drip milk, you wouldn't give them the lasagna. They didn't get that pasta and whatever else you put in your lasagnas. So it's thinking about, if you use hacker milk or drip milk, if you use Shields, then actually that's lower fat milk. It's full of sugar, but it's lower fat, so the baby probably won't go quite so long.
What you might want to do is pump and then mix it with some of the pumped milk, so that you get some of the pumped milk that's got fat in it. So if you pump after a feed, obviously there's more fat in the milk because you've drained your breast, and so you'll get more fat out. So you can mix that with hacker milk if it's in the same days, and within 5 days, and then you can give it as a top up. But it is if you do leak and you only feed on one side, the other thing with the hacker is if you drip on the other side and your baby goes to that side, you've taken some of the milk out of your breast. Some mums say they drip anyway and it would be wasted. But some people collect about 60 mils dripped breast milk while they're breastfeeding on one breast. But if you put your baby onto the other side, they don't have the same amount of milk, and then you end up giving the milk from the hacker to your baby afterwards, because
rather than taking it directly
from the breast. So every story is different, and every need is different. But just be wary of them. But that is sometimes what mums think is a pump and collecting milk.
Yeah, so I think thinking about you going back to work, you could think about beginning to stockpile some milk, so you've got a leeway, that you don't feel under pressure to have milk ready when you start at work. But if you're feeding quite a lot in the day, the likelihood is you're going to have to pump at work. And as we've mentioned, you do have some rights. You are expected to, that your employer should provide you with a lockable room and not a toilet in which you can pump. And they should provide you with a fridge where you can put your milk,
where you can wash your hands and things.
So it's not great big things, but it's things that will make it easier for you. So for instance, here in this hospital, if we've got staff who will need to pump, we have a pump room for them here in the maternity unit. So we do have that provision. So that's that would be that. So you could stockpile a bit of milk, and then when you're going back to, on the other days you're going back to work, is to, as we mentioned, think about having times that you go and pump. And you can be guided by how you're feeling. You're thinking, oh, I feel a bit full, now I'll pump. Or you could just do it, to a regime, whichever suits you best. But keeping your breasts comfortable. And then that milk can go in the fridge, and that's your baby's feeds for the next day that you're working. And then because you've stockpiled some before you've gone back to work, you have milk for the first day or so, and then you've got milk going on.
And it depends how you go back. I mean, you might go graduated days to start with. And it might be that you've got a childminder or you've got a partner staying at home rather than going to a nursery. And so they may be able to come in and bring your baby to work for a lunchtime feed or something in the early days, so that you gradually wean yourself off. It doesn't work for everybody. And not everybody's got the luxury of a family member that could do that, but sometimes you can go home in your lunchtime and do it. Some mums worry more about going back and making their babies upset that they've gone away again. So it's not always that you can't breastfeed initially when you go back to work. So it might not be that you have to go cold turkey straight away. I think the other thing is how you're going to give that to your baby, depending on how old your baby is. Are you giving it in a bottle or are you giving it in a cup?
Have they ever
had one before, and are you looking at trying to do that? Because that's the other issue, is if your baby won't take bottles.
That's come up here numerous times, parents saying they're going back to work and hadn't started on a bottle and they're struggling. We had a lady, I think it was last week, who was asking, she had 2 weeks to go, and it's like, I would start sooner rather than later, trying to get your baby used.
Just do it once a week.
You're used to it.
And get used to somebody else giving it to them, so your partner might want to do it, or parent might want to help you with that, so that they get used to somebody else doing it. I mean, often they won't take a bottle from their mum anyway, because they don't like the idea of having milk in a bottle and not from the breast. They're horrified.
Well, they know where it comes from. It comes from
and lots of mums call in saying, we're spending 3 months trying to get breastfeeding perfect, and I'm going back to work in in a month's time, and I can't get them to take the bottle anymore. And it's it is. There's always a story behind it, but mostly babies will take it, but don't always feel that you've got to give a bottle, particularly for babies over a certain age. They've certainly got to 10 months one, they can use a cup. Don't feel that you've got to give them a bottle.
And the other thing to bear in mind is that when you do go back to work, is that babies often don't ask for as much when you're not there. So if your baby's being cared for by someone else, the likelihood is they probably won't want to feed as much as they feed when you're about. But presumably your responsive feeding,
much more than food.
Yeah, and there's so much more than just the milk transfer. And often babies, when they are being left with someone else, don't ask for as much food during the period of time when mum's not there. But you might find the night time you're a little bit more busy, because your baby, as I mentioned earlier, they're checking in, they're making sure you're here, they're going to get you to meet their needs. And they're like, oh, my mum's home and I'm going to spend as much time with her as possible. So,
you will be busier. But, the recommendation for UNICEF is that you feed for at least a year, and for World Health Organization for at least 2 years, so into your baby's 3rd year. And babies rarely self-wean before that. They rarely self-wean. It's normally a mutual, or, one of them the mother decides that it's not working, or that they've had, they want to finish it. Babies don't often stop breastfeeding. Some do. But a lot will just keep going until they're into their 3rd year. And but just remember, if you've got a 2-week-old baby and you think, oh my goodness me, I can't think of anything worse than feeding a 2-year-old, they don't feed all the time. They're not on the breast all the time like they are with a newborn baby. They're obviously having steak and chips alongside everything else, and drinks. So it's not all the time, but some might feed 1 or 2 times a day at 2, and that's perfectly normal in the world. So
I surprised a mother and her mother-in-law in clinic today. We were talking about weaning ages, and I said, well, right, are you ready for this? I said, the natural weaning age for humans is somewhere between 3 years and 8 years. Now, I didn't say 3 years, I said 3 and 8, and they looked at me, I went, years. And that is what they think the natural weaning age is for human babies or human children. So, to feed till 2 and 3 is not unusual. Maybe 8 less common, but certainly 2 and 3. Many children would if they have the opportunity. But you have a say in that. This is the conversation I had with them, is that you have a say in that. That's not, if it's not what you want to be doing, you definitely have a say in that. But 6 months exclusive is the ideal, up to a year alongside other food, and anything beyond that is still beneficial. So,
and food before one is for fun.
Yeah.
We say that every week, you know, that you always give a breastfeed first and then you give the solids and then finish with a breastfeed again.
Right, we better get through some more of these questions. So, Caitlin, good luck with that.
And I hope that answered your pumping.
Yeah.
If you're not sure, give us a ring.
Yeah,
or ask your
more than
health
happy.
Yeah.
So hopefully Georgina's was the next one, saying she'll put a question through, which is great. Tessa has said, hello, I'm due in February and starting to worry about the care I will receive. How are the staff shortages affecting care at the JR? Well, we are maintaining one-to-one care in labour. There will be no changes in that. You will get a midwife who will look after you throughout your labour. Then you get transferred either, depending, as I mentioned earlier, depending on your birth. You might go to observation area if you've had a bit more of a tricky birth, or you might go straight to level 5.
Or you might be on the spires if you've had a spires.
You may have had a spires birth, in which case you'll have had your one-to-one care, and then you'll be one of a few on the ward, which it's not a big ward. If you're on level 5, when it's at capacity, it's about 43 women, and their babies, obviously. And the staff will do their best. We are giving the best care we can, and we are maintaining our standards. And you will get supported. You might need to buzz to ask for the help. So, you know, from the point of view of feeding, ask for it. Say, you know, press your buzzer when you're ready to feed and say, can someone please come and help me? So you do need to be fairly proactive on that one. Writing a birth plan will help as well with the care during your labour, because that will tell people what you want. And then, in a way, a verbal birth plan when you meet your midwife. Tell her what you want her to be able to do for you. And you know, we are looking after mothers as best we can, and we have
not busy like we were a month ago.
No, it's definitely quietened down.
October was quite historic.
Yeah, it was
quite busy, and you know, everybody felt the brunt of it. You know, staff and mums. But you know, it's steady, and as Alex said, you know, ask for help when we don't know when you need help, so you have to ask us. You know, we're running around doing stuff, or the staff on the ward are running around doing stuff all the time, but they're there to help if you need support. And you will have a named midwife on each shift that will come and introduce herself, and she will be looking after maybe 8 or 12 women, depending on what the staffing is. So, you know, she'll be going round, it's usually 8, but she'll be going round and round and round all day, seeing them. And some mums' needs are more than others. They've got more observations and things to do. They've got more clinical need. We've got, you know, quite a range of type of mums that come in. Some have got more medical needs than others. It is a big tertiary hospital, so we do get complex patients in the ward. So they do sometimes take up more time than non-complex ones do, but you are absolutely, you know, we expect you to call and ask for help for feeding and for baby care and for attending your needs postnatally, bladder care, you know, all of those things. They will be caring for you every day, and it might be that it's someone different on every shift that you get, but the shift is 12 hours usually, so you will have the same person all day. And it might be that she takes a bit longer to get to you if she knows that you're okay and you're not needing lots of medications or lots of complex observations or procedures done. She will make sure that those complex things are dealt with, but she will know that you're there and you ask for help. You won't necessarily see the infant feeding team unless you've got something that we would be worried about. So we as Alex said last week, you know, there's about 43 women on the ward today again, and we've only got one woman that we need to see on the ward today. The rest of them are normal, so you know, they don't need to see the infant feeding team. They're looked after by the staff.
We train all our staff, and all the midwives that are coming in and starting have come through universities that are BFI, Baby Friendly Initiative accredited, which is a standard with regard to feeding support. So they, you know, our staff have the skills to help you with feeding. The other thing to say, Tessa, is obviously when you go home, and you may choose, you know, if you have a lovely straightforward birth and everything's going well and no one's concerned about you, then you can go home on the day of delivery. There's no reason to have to stay in. And if you go home, then you will get a visit from your midwives, or you will be asked to visit your midwives the next day, and you will get care dependent on how much you need it. But you'll see the minimum the day after you get home. On day 5, when the baby's weight is checked and the heel prick test is done, and on day 10 when you're discharged. And in the meantime, if you need more support, you will see somebody.
You'll ring and ask them.
Yeah, but you do need to be the one who asks.
and the numbers are on the front of your care plan.
Which you'll get
when you go home, you'll take this with you, and it's a little booklet that's got lots of things in it. One of them is that, which tells you the green line here is good, and the amber line here is not so good.
It's a feeding assessment that you can do yourself.
Highlight, so you can read through these and tick the boxes. And if you're ticking lots on this side, then you think, actually, I'm doing okay. If you're ticking everything on this side, you probably need to pick up the phone when you put the care plan down and ask for somebody to support you and ask some questions. So your midwife is the first person that you'd ring. If you've got this book, you're still under the care of the midwives. When they take this away, then you're under the care of the health visitors. And so, you know, they take on the care, and they look after you until your baby's about 5. And they're there, and you ring up. They don't offer lots of visits unless you need it. And also, you've got all the support in the community. So you've got the Oxfordshire Breastfeeding Support, latch League. You've got the satellite clinics, so the ones that we do. You've got in the community units, you've got breastfeeding support. So in the midwife-led units, so you've got Wantage, Wallingford, Banbury, Chipping, Norton. Yeah. They all have got facilities in the first couple of weeks in your area that you can ring up and drop in and get some breastfeeding help. And certainly if you're in the south of the county, if it's the middle of the night, you can ring Wallingford and get breastfeeding support and advice. And if you're in the north of the county, you can ring Banbury to the Horton MLU, and they will support you, and you can go in and get some help there as well. So you can go in the middle of the night if you're really struggling.
If they've got the capacity.
And they can see you if they haven't got lots of women in labour.
And there's also the Abingdon Breastfeeding Cafe, formerly known as the Abingdon Baby Cafe.
Yeah. So you know, the numbers are all there, and you can. But you know, there's lots of support, and it's all free. You don't have to pay for anything. It's all free. Yeah. But your midwife is the first person that you would call if you're worried. And if you think your baby's not peeing or pooing enough, or you can't get your baby to feed, you need to be calling them that day. You don't wait 3 days for them to come and see you. You call them on the day that you're worried and say, I'm worried about feeding, my baby's pees and poos have changed, or they're not doing poos, and you can't attach your baby to the breast, or you don't feel that you've got very much milk, then you need to call somebody. You take the action there and you call somebody and say, I need help, and they will see if they can get you in to have an appointment and come and see what's going on and make a plan. And if they have any concerns, they will call us, and we'll have a discussion with us about a plan of care as well, and they'll go through it with us.
I hope I've reassured you, or we've reassured you, Tessa. We will look after you. You know, everybody, all the staff come to work to do a good job. We do not come to work to do not good job. So we will do our best to give you the care that you are hoping for and expecting, and we want to give. So so whilst midwifery, you know, we do know maternity has got a bit of a problem with staffing. We are doing our best to make sure that's
national, and you've probably read it in the papers.
We're doing our best to make sure that does not impact on the care that you get. Okay. So Naomi has said, also, when we were in hospital, we benefited from donor milk. I have a really good supply and would like to donate. How do I go about that? If you go onto the hospital website and go into maternity, so OUH maternity, and then you can put milk bank. Or you can go via our page on the feeding page. There's a link to the Oxford Milk Bank, which is run by Amanda Wood. She's the milk bank coordinator, and there's some forms that need filling in, and you would need to have another blood test done, the same blood test you had done when you were booked for pregnancy. So it's all the different things that you had at that point in time, and assuming those are negative and that you're not on any meds that contraindicated, then I'm sure Amanda would be delighted to have your milk. And this is very often what happens. Mothers benefit from a bit of donated on the ward, or they maybe get a little bit, you know, to tide them over, and then they donate. And that's why we've been so lucky with our milk bank. I mean, we've been able to have free use of it on our wards, unusual for a hospital.
We're the only hospital in the UK that does it.
Pretty much. And for the last almost 2 years, beginning of COVID, we've been really lucky. So that would be brilliant, Naomi. And if you have a look, OUH, you can go OUH maternity and then milk bank, or just do a search OUH milk bank. It'll come up, and Amanda's details are there, and have a chat with her.
Well done, thank you.
Yeah, wonderful. Best present you can ever give. Maxine has asked what are the current visiting hours at the John Radcliffe. I'm due in April. It's throughout the day for partners, one visitor though, and the same visitor all the time, so it's usually partners. If your partner isn't going to be visiting, you can normally nominate somebody else, but there can't be swaps during the day. It's one person all day, and it isn't swapped one day after another unless there's a particular reason. So
and the latest updates are on our website, so look at the hospital website, the John Radcliffe website, and it will give you the visiting for all the different departments in the hospital.
So obviously you have your birth partner as well, because I noticed you put for postnatal on here. So that's what I mean, is it's the partners can come for the whole day. I think it's 9 till 8 or something, so it's quite a long time. Do check on the website, and you have your partner with you throughout labour, okay? And we've never stopped that at all. Even when we didn't have visiting on the postnatal wards, we always had birth partners.
And for a few hours after you've had your baby as well.
Sally has come on. Thank you so much, ladies. Emma has said, hello. Hi, Alex. Hello, Emma. I was so pleased you weren't here when I came back to work. She says, I've reduced flow on my left breast despite feeding and pumping. How can I increase the flow back to what it was?
Compressions.
Compressions. Keep going with that, because you were using a hand pump when you were doing really well with your hand pump. Maybe just increasing the frequency of how often you're doing it. Remember what we were talking about, which I think you were doing anyway, so pumping, little back gap, pump again. Just keep going, and if you can get her on, then she's going to do the best deal. You know, she's going to do much better than you are with your pump, so keep going. I was so pleased when I came back to work and you weren't still in that room. I went off to have a quick look, but I hope you're enjoying being at home finally. So it was a long old stay. Give me a shout if you want, and we can have a quick chat about what's been happening. But I think it's the frequency. Try and increase the frequency of milk removal and see how you get on. Obviously think positive thoughts, because you were doing really well. Once you've established a milk supply, it's still there. You know, it's like you've turned all the switches on. So maybe it's got, the supply goes down a bit, but the switches are still turned on. You can get back up again. So the fact that you've requested that much milk and had that much milk, you can get back there. So I think it's a case of getting her to do as much feeding as possible, and you know, upping the pumping on that side, just to remind the breasts we need that bit more milk, and see how you get on. Lovely to hear from you, Emma.
You. Keep going. Lots of skin to skin. Lots of skin to skin. And enjoy.
Yeah, enjoy being at home. Poor love, she was in for ages.
Get pampered.
Yeah. Susie has said, I realised that I still got some colostrum in my freezer. My baby is now 10 weeks old. Having 2 under 2 meant it got somewhat forgotten after the first couple of syringes. Is it worth giving it to my baby at this point? You could do, or you could wait till your baby has a snuffle or a cold, because it'll be great.
In a fruit juice or something, or a smoothie, or.
Well, no, but the baby's 10 weeks. We're not.
Oh, 10 weeks.
We're not giving smoothies and not giving smoothies.
Being dozy. Sorry. Yeah.
No smoothies. Yes, you could get.
No, don't do that.
Yeah, you could give it. I mean, it's, as you know, we mentioned earlier, chock-a-block full of every antibody you've ever had. So you know, if your baby's looking, you know, if the others have got a cold, and it might be worth giving then. Just bear in mind it's a laxative, as we mentioned at the beginning. So the likelihood is your baby will do a lot more pooing if you give it. But yes, by all means, use it up. You know, you can give it. But yeah, quite handy if you know.
Give it to your toddler.
Well, if they've got a cold.
Yeah, if they've got a cold.
Yeah.
I'm
sure you've got loads of colds going around your house. On their porridge. You do, why not?
It's got COVID antibodies in it, they'll get those as well.
Yeah. So yeah, use it up though, Stacey. Don't lose it. No, use it, don't lose it. No. Kitty has said, hello ladies, my son is 7 weeks old and has been exclusively breastfed in the past few weeks. He started fussing while feeding. He sometimes, mostly in the evening, cries in distress, flexes himself and doesn't want to latch on, even though just minutes before he was rooting on my shoulder. Sometimes he screams with my breast in his mouth and refuses to take it, and beats and scratches my chest. Oh, poor love. Other times he's just fussy, comes off regularly and rubs and scratches his face and head and moans. I'm wondering whether this is normal for his age and it will pass. If not, do you have any suggestions to improve it? Thank you. Also, thank you for these sessions. I've been listening to you since I was 20 weeks pregnant, and you helped me be prepared for our breastfeeding journey.
Oh,
thank you, Kitty. That's why we do it.
Yeah, that's what makes all the difference.
So he's 7 weeks.
Have you given a bottle at all? She said exclusive, didn't she?
Yep.
So no, there's no bottles or anything with flow. It might be that you know, he could have a little bit of an earache, or he could have a little bit of, you know, something's happened. If you've had a big letdown, it might be that he's you know, getting a letdown really quickly, and he's struggling with that. Is the positioning really good? That's
where I was going to go. Yeah, just remembering that as your baby gets older, you need to allow for your baby getting older. You know, when we have a little baby, we've got them here. When you've got a big baby, you've got them here. So if you notice that, if I had a doll, I'd show you. If the head is here, the body's coming on round you. It's not going, we're not going like this, we're going like this. So make sure you're still starting nose to nipple, and that's what we often see as the baby gets bigger. The mum's just centering the baby in front of her, and actually she needs to keep the nose to the nipples, we've always said before, and then the baby comes round. So make sure that's happening, because if your baby's not getting the mouthful they're looking for, then they'll get a bit shirty and may not be very happy because they're not able to get the flow going that they want, which is what Naomi's referring to.
I mean, if they've had a cold, if they got a bit of earache, you know, sometimes they you know, get a bit of a sore ear if they've been really congested. If they haven't had a cold, then you know, it could be just that it's the fact that the milk is hitting the back of their throat in the wrong way and they're not enjoying it. It might be that your supply is just sort of sorting itself out and you've got quite a forceful letdown suddenly. It might be that the supply's dumped down a bit and it's not so forceful. I mean, it could be lots of different things. I would say, you know, use your local breastfeeding support. See if you can get a session with somebody to watch what's going on if you feel you need to. It might be your health visitor. It could be the local supports nearest to you, so OBS, latch, the breastfeeding cafes. You can call us and talk to us if you want to have a conversation with us. We're very happy to talk to you. At 7 weeks we can't see you in our clinics, unfortunately. We take 6 weeks, but your health visitor should be able to support you. But you know, just if it continues, then just have a look at the way that your baby's attaching and just see if we can make it a bit better. It might be that you need to change the position to a slightly different position for a baby that age. If you're doing cross cradle, it might be that you sit him up and have you know, help himself, or he can be across you diagonally and help himself. That might help. You know, lots of different things. Does he feed better if you're lying down in bed? Does he seem more settled when he's in a different position, or is it every position that you try, or are you just using one position? You know, it's worth having a conversation with somebody just to go through it, to make sure that you're doing absolutely brilliantly. And as Alex has said, you know, they get bigger.
Yeah, allow for it.
And the shape of their mouth gets bigger as well, remember, so that changes a little bit. So you do have to adapt with them. And that, you know, it is just tweaking it a little bit, and it can make a difference.
Be worth getting some support, Kitty.
Yeah, don't struggle.
Sophia has said, hello, I'm having identical twins, my first babies. I've got to have a C-section. Am I better off expressing when I'm at hospital, because I don't know how well they're going to be when they're born? They have said we'll plan C-section 34 to 36 weeks. I'm 31 plus 1. I don't want to try and express early, as I don't want to bring labour on. I really don't know what's best to do. Hang on until you're in and then express. So once you've got to sort of the eve of your C-section, you could be thinking about expressing then. We don't really want you expressing early for exactly what you've just said. A very small risk of putting you into labour, but we don't want your babies any earlier than they need to come already. So
and 34 weeks, your babies will be quite immature. Some babies at 34 weeks will feed, and mostly they won't. Mostly babies do not feed well at the breast at 34 weeks. Babies at 36 weeks often don't feed well at the breast either. So, and when they do, we know that we're not reliant on what they're doing is good enough. They can be very good at looking like they're feeding like Trojans, and they're not. So, you know, any baby that's under 37 weeks, and even at 37 weeks, you know, we would say breastfeed and top your baby up with ex-breast milk, or donor breast milk if you haven't quite got enough and they need more. They will need more food if they're premature. Their blood sugar level is not reliable. They can't maintain their blood sugar levels in the same way as a term baby that's healthy. And if they're premature, they don't have the fat reserves to do what we call counter-regulation, where they can rely on their fat reserves to give them calories. So they have to be topped up after every feed, and that will carry on for quite some time when you go home as well, that they will need extra food on top of your breastfeeds, even if they're feeding really, really well. And you will need to keep doing that until you absolutely can't get any more milk into them and their weight gain is okay. So if it's little, did you say little girls? You've got identical girls or identical babies?
Identical babies.
So if it's a little girl, little girls, it'd be 20 grams a day, and if it's little boys, it's 30 grams a day. So you need to make sure that they're managing that and they're retaining that after day 5. They shouldn't lose weight after day 5. But babies that are preemie need topping up every day, all the time, 8 times a day.
So I think the key thing is to make sure you establish your milk supply. So the biggest factor that you can impact on is that as soon as they're born, make sure that you try and get them to the breast.
Skin to skin.
Back it up with expressing and really get on your milk supply. We know there's a 2-week window, but those first few days are really crucial. You know, you're going to be having an elective section, so hopefully you won't feel, you'll be uncomfortable, but you won't feel too tired in the same way as if you've been through labour and then had a section. So hopefully, you know, from that point of view, we can get you expressing quickly, you know, soon after birth, and that you're going to back it up. Because we need to tell the body to make this amount of milk. Milk supply is driven by milk removal. I say it all the time, and the more you ask for, the more you'll get, and those early days are crucial. Naomi mentioned earlier on about a mum she'd been with who was getting quite a lot more milk on one side than the other. It transpires that you know, that's the side the mother had fed on at birth, and it just shows that those early milk removals are so crucial. So really get them on, get hand expressing, tell the body they're here, and really push it. And we have a fairly low threshold for getting you on a pump at this stage too. You know, we get you hand expressing initially, and whereas with most women we would be getting you to transitional milk, so 3 days 3 to 5 before we put you on a pump. The likelihood is we might be getting you on a pump a bit sooner than that in order to really push your supply. Because we need you to have a good enough milk supply to feed 2 babies. And it's possible.
Skin to skin in that first hour is also crucial, and with 2 babies that's even harder than 1 when you've had a cesarean. But we know that mums that have cesareans are the ones that come back in with weight loss predominantly, because they don't get the skin to skin in the first hour, and they don't get the baby on the breast in the first hour or hand express in the first hour. So the more you do of that, the more you're going to produce milk. You'll get a big surge of hormones which will make milk, and that secures it. And you know, you've got 2 babies to feed, and we say, you know, by about 10 days, 2 weeks, you should be making about 750 a day, 750 mils of milk a day. So, you know, not everybody needs that much, and not everybody makes that much, but that's what we would aim for. And you know, and I know in the neonatal unit they say slightly more even after about 2 weeks.
And there are 2 babies here.
And you've got 2 babies to feed, and you know, if your baby's having, you know, good sized feeds, you've got to make the same amount for the next one as well.
But I just want to say it is possible. It is definitely possible.
You can do it.
We've got a family member who has exclusively breastfed her twins, and I've given her support at a distance because she lives in Cornwall, and she sent me some beautiful photographs of her babies at the breast, little boy and little girl, at 6 months, and she'd managed to exclusively breastfeed them. It is possible. You can do it, and as long as you ask for the milk, you will have it.
But you know, you get on it on day 0, so you're feeling really pretty groggy after you've had a cesarean, and there's 2 babies sitting in the cot next to you, and you just think, oh, how am I going to do this? I'm just so tired, I want to sleep. But you have to hand express as well. 8 expressions in the first day, you know, and if your babies aren't feeding, 8 expressions means 8 lots of hand expressing. If your baby's suckling because they're 36 weeks and doing it, you can do some hand expressing, but you know, some of the suckling will be the stimulation, but don't underestimate what you can do. And that starts on day 0. That's every single mum that has a baby. Day 0 is the day that you start doing lots of stimulation, not day 3, because you will be behind and your supply will go down, and you know, then you'll be in our clinics and there'll be tears because you haven't got the milk. And we see it so many times. So, you know, don't say you're too tired to do it, just do it. And then you'll be happy because you've got milk to feed your babies.
So I would suggest that if anyone's offering to buy you a present, that they buy you a pump. Get a pump before you've even had your babies. Now normally we don't say that, but you know, because you know you're going to have your babies early, you are going to need to be pumping to push the milk supply. So, you know, a small double pump would be just fine. You know, one of the ones that we often use and we've used in clinic are Ardo Calypsos. They come in at about £100 and they're a double pump. They're very, very simple.
Little pack horses.
Yeah, they're very good.
Yeah.
So
they're little and you can carry them around, and they've got batteries, haven't they?
Yeah, you can do batteries or power mains. So it's an Ardo Calypso. So you'll find them on Amazon and from Ardo themselves, but they are very good pet pumps. Right, well, good luck with that, Sophia. For all the right reasons, I hope we don't come across you because you're doing so well. You don't need our support, but if you do need our support, then obviously get in touch. But, Claire has written, I've tried to call today about feeding, would really appreciate a call back. Is there any chance anyone is available today? Well, we'll be back in the office and we will be returning all the calls that have been left. Emma, I think, has been picking up calls as well, so she may have taken your message down, but yes, we'll be back in the office, and anyone who's called today should be called back. What time are we now? 3:30. We'll be back about 4 in the office, so expect a call from us if you've left us a message. Heba has said, good afternoon, I've saved up all my questions over the past week, so I've got lots today. Brilliant. She's even numbered them. My baby's 3 weeks old today and I'm exclusively breastfeeding. Woohoo! Do you have any tips for helping a baby with congestion? My baby had a stuffy nose a few days ago that was affecting his ability to feed, and he was getting really frustrated and kept coming off the breast. I tried saline drops and putting him in a steamy bathroom for a few minutes. He's better now, but wondering if you had any other tips in case it comes back. Should we start with that one?
I think doing what you did is pretty much it. You know, it is just a question of time. I don't know if you've got a toddler already that's passing bugs on. Bad luck if your baby's got a cold so early, if you haven't. But you know, the more you breastfeed, the more the nasal passages open up. So it spreads their postnasal space up, and it tends to open their nose once they've got on. But you know, a little sucky thing sometimes helps with the nasal, you know, the saline drops, and you just give little and often, so that they get lots and lots of fluids over a period of time.
If you can manage an upright position, so the baby's not on their side when they're
back to this position here.
So having them upright. So Naomi's showing with our teddy bear because we forgot a doll. So an upright position, so the baby's sitting literally like they're riding a horse across your leg, and they're facing you, so they're upright, because you know, I think you must feel the same as I feel the same. If you lie down with a stuffy nose, it's worse, and if you're upright, it's much better. So you could try more upright positions, or even if you want to do cross cradle, you could have them leaning down you rather than being completely flat. So that may help as well.
And I think the most important thing to say is if they were getting formula, they'd be much more snotty. So you know, the breast milk is really good, and just keep an eye on them, and you know, hope they're not coughing and you know, wheezy or anything. And if you have got any worries, because it is the season for babies to get respiratory viral problems, they can get quite poorly very quickly, so keep an eye on that, and you know, talk to your GP if you're worried. But yeah, saline drops is great. I think the other thing you can use is something like Snuffle Babe and put it on the top of a wardrobe in a hot bowl of water or something like that, to or you know, a diffuser or a vaporizer or something like that with some things in, but not directly on your baby. They shouldn't have anything on them that's got vapour or anything before 3 months old, because it can actually stop them breathing. So be very careful what you're using. But you know, you can put it a long way away from them in boiling water on top of a wardrobe or something, or outside the room, and it sometimes does help the vapour, like a vapour inhaler. But be very careful with that as well.
Now that was question 1 of 3. So the next one is, can what I am eating affect baby acne? Is there any food I should cut down on to reduce his acne? No.
He'll get it whatever.
Yeah.
You know, they get it from about 3 or 4 weeks onwards. We call it 6-week acne because they often get it, you know, the worst is at about 6 weeks, and it comes down their chest, down their back and across their cheeks, and it's just a hormone withdrawal from you.
Yeah.
So
it will just go away.
It will go away.
And amazingly, their skin goes back to gorgeous, you know, just beautiful skin. You can't imagine it.
But it's just as you want to start taking photos.
I know. I can remember going to my brother's engagement party with my daughter just covered. It's like, So, number 3, how do you know when a newborn has colic? My baby's constantly unsettled and crying throughout the day and wanting to feed unless he's held in a sling or sleeping on the breast. Luckily, he's fine to be put down in the crib for naps at night. so I can get some sleep, but just not during the day. Is this normal?
Well, normally it's the other way around, so it sounds like it's, you know, the right way around for you. Colic's just a word, you know, is it that he just wants to be with you all the time? He can see you, and babies love being carried. They love being in a sling, and as long as you're around, they'll want to be carried around, and I think that's where they also expect to be, isn't it? So they would want to be with you. They're not made to be separated from you in the daytime or the nighttime, really. You know, the expectation as mammals is that they're with you as a mother constantly, and that in our culture is something quite difficult for most families to cope with, and so people adapt to work around their own families. But I think that they expect to be there, and you know, as long as he's feeding and reaching all his milestones, so he's peeing and pooing and he's gaining weight, you know, and feeding appropriately, so not feeding constantly but just wants to be cuddled, then that sounds quite normal. But if you don't think that he's doing things that he should be doing, then you probably need to talk to somebody and get him checked. But you know, colic is just a word, and if he's only doing it in the daytime and he's settled at night, then it probably isn't a feeding issue. If he's managing at night and more settled and going down into his cot at night. I don't know whether you've got anything else to add to that.
Well, I'm just thinking, I mean, he's 3 weeks, so I think, you know, just remembering that you're looking to have two £2 coin size minimum yellow stools a day, so you're looking for at least 2 poos a day every day, and 6 heavy wet nappies. Now if he's not managing that, it might be
30 grams a day in weight.
Yeah, he might be needing just a little bit more food. So, you know, thinking about why he's doing these things. So having a baby in a sling is the most fantastic thing to do. Naomi mentioned our babies do not expect to be put down. They do not expect to be left in cots or prams. They expect to be in your arms and cuddled and loved, and that's why slings are so fantastic. They've got no idea that when they're put down that they're safe. They're hardwired to want to be in your arms because they know they're safe in your arms. So, and every contact you have with your baby, and I think we say this every week, every contact you have with your baby, whether it's having them in the sling, keeping them close, cuddling them, you know, chatting to them when you're changing a nappy, stroking them, loving them, you are boosting their oxytocin levels in their body, and oxytocin is the brain fertilizer, and that means you're growing a happy baby that will become a happy toddler, that becomes a happy child and a happy adult. So, you know, it's always remember that every piece of contact you have with your baby, keeping them close, meeting their needs, is doing them an amazing job. So
let's keep going. But you know, if you've got concerns, talk to your health visitor.
Yeah, make sure you're hitting those marks on poos and wees.
Yeah, just have a little look at what's happening, and go along to your local breastfeeding support just to see what's happening as well if you need to, just to be doubly sure. But it sounds like you're doing everything really well.
Right, next one's from Susie. She goes, "It's for you, Naomi." It says, "Naomi helped me with the initial breastfeeding issues I had with my son around Christmas 2019.
Wow.
He's about to turn 2 and still loves breastfeeding."
Oh, what a star are you. That's so fantastic.
Isn't that nice?
Well done, Susie. That's such lovely news.
Caitlin said, "Thank you very much for the advice. Planning to only pump for when I'm not home to cover his feeds and to continue breastfeeding when I'm at home." Perfect. Well, that's the best of all worlds then. So lovely. Well done. Good luck with that. Go back to work, Caitlin.
Yeah.
Fru has said, "Thank you very much for your advice and keeping on doing these questions and answers. We have no intention of stopping." So
you're not going to get rid of us.
And it's lovely because we get different people. It's lovely when you come back and say that you've been
and tell other mums how it's been for you, because that's really encouraging to keep other mums going. Because
there still isn't as many sort of support groups out there as there have been in the past. Prior to COVID, there was a lot more going on, a lot more drop-ins. You know, it is difficult still. Tessa has said, "Very helpful and reassuring, thank you." Emma has come back and said, "Thank you so much and for your support." Absolute pleasure, Emma. It was lovely to meet you. So, and Claire has written, "We've come home on donated breast milk and running low, and I'm worried about transitioning to formula. On domperidone to stimulate my milk, but not producing nearly enough. 120 mils in 24 hours due to surgery when younger. Really need some advice on where to go from here. Is there an option to get some more donated? Would really appreciate a call. Your team have been amazing through my journey." We will definitely give you a call in a minute, Claire. We will be there. We'll probably put the kettle on, grab a cup of tea, and then come and give you a call. Kitty has said, "Thank you, Refussy 7-week-old. I haven't given him a bottle yet and tried to allow for him to grow with positioning. He's just getting over a cold." Aha, there you go. However, it may be just that. I will look for some support if it does not improve. Thanks again. So a cold will have all of those effects.
Feel rotten, just like it makes you feel rotten.
Yeah, and if his nose is blocked, he's going to come off on.
Yeah, and splutter and be really congested. Yeah, and he might have earache.
And Sophia's come back, so thank you so much. I may see you as being born, the baby's being born at the JR. In a way, Sophia, hope you don't, because if you see us, it's because you're having a problem. So the mothers who have met us have had a few problems along the way. So the ones that don't see us are the ones who are doing really well, don't need our support. But we love meeting you all, though. We really do. So was that one? I'm just going to make sure I haven't missed anything. That was Sophia. Kitty's come back. I've also been experimenting with different positions, cross cradle and laying down. Work best for us. We'll continue working on these. Brilliant.
Definitely.
Heba has come back. Brilliant, thank you. He's got an appropriate amount of wet and dirty nappies, so that's reassuring. That's very reassuring.
Sounds like you're doing an amazing job.
Right, well, we're at 15:41, so we've done an hour and 11.
Yeah, we're on overtime now.
So we're going to have a week off next week, so that's your opportunity to go Christmas shopping and not miss us. And
we'll be back the week after.
Yeah. So
that'll be nearly Christmas Eve.
That will be. It's the 23rd.
Yeah.
So that'll be our next one.
Christmas questions.
Yeah. So all these Christmas babies. So, right. Well, thank you very much for your questions.
Have a good couple of weeks.
We will speak to Claire imminently. I promise. And we'll go and get your number because I'm sure you've left it.
Yeah.
And all the best.
And if we haven't got your number, then ring us back. If for some reason it's not come through to us, and we don't ring you back, it's because we haven't got your number. Okay, so don't hesitate to call back if we don't get back to you because we haven't got the call, because there has been someone in the office most of the day.
So hopefully
that we have got the message. All right, have a good week.
Bye.
Bye from us.